So let's dive a little bit more into the actual alimentary canal. So the alimentary canal is a luminal cavity that is four tissue layers in terms of composition. The overall length of the alimentary canal is that 8-meter length. However, if we look at the total surface area of what's available, we're talking about hundreds fold total surface area. And the reason why we have a hundredfold total surface area within the alimentary canal is because of the mucosal layer and its structures. In the mucosal layer, we're going to have various anatomical structures such as circular folds, villi, microvilli, as well as a whole bunch of cells that are going to be involved with the chemical digestion of the foodstuffs that we are consuming. We're going to take a look at this in terms of a picture here in a second. I'll get more detail into what the villi and the microvilli are actually doing. Deep to the mucosal layer is going to be the submucosal layer. The submucosal layer is going to be housing all of the vasculature, the lymph, and any of the nervous system that's going to be involved with the regulation of digestion. Superficial to this, as in terms of closer to the surface as opposed to closer to the lumen, will be the muscular layer. For the majority of the alimentary canal, it is a bilayer in terms of muscles, 2 layers. However, in the stomach, it becomes a third or a tertiary layered muscular system. The outermost layer is what's referred to as the serral layer, and the serral layer is going to be serous epithelial tissue that's going to be producing a mucus secretion to it so as to not allow for it to bind onto the overlying connective tissue. This serum is going to connect directly with the omentum, the parenchyma, and the mesentery connective tissue that we saw with the vasculature in terms of the blood vessels coming in and out of the alimentary canal. So if we take what we just briefly looked at in terms of structures, let's go ahead and take a look at it in terms of a pictorial representation. And so the alimentary canal has a ringed surface to it, what we refer to as the circular folds. What the circular folds are going to allow for is going to allow for the expansion and then collapsion of the alimentary canal based off of peristalsis and the movement of material through the alimentary canal. It does this so that it will not lose its structural integrity, similar to what we saw with the heart as well as with the arteries in terms of the ability to expand and then return back to its normal shape. Lining these circular folds are going to be structures which we refer to as villi. Villi are the cellular protrusions coming off of the circular folds. A lot of the cells on this villi are going to be ciliated and microvilliated. The microvilli and the cilia produce what's referred to as the brush border. This brush border is where we're going to have the majority of the digestion take place, as well as the majority of the absorption taking place. Within this villi formation, we're going to have a host of secretory cells, which include the goblet cells. We will have columnar ciliated and columnar microvilliated epithelial cells. We will also have a cluster of immune cells formed what's referred to as the Pryor's patches, as well as connections to enteric tissues, such as the enteroendocrine cells, which are going to be involved with regulating the rate of regulating the rate of digestion taking place. A lot of the goblet cells are going to be the secretory cells within the tissue. The more often a food is eaten, the more readily these goblet cells are able to produce the digestive enzymes necessary for digestion. However, the less often food is digested, the lower the ability for these cells to produce the digestive enzymes, and it will alter the rate at which motility takes place, speeding up the rate at which peristalsis occurs, moving foods through the alimentary canal much faster. Deep to this tissue layer within the alimentary canal itself will be the submucosa. The submucosa forms a rigid structure within the circular folds upon which the villi will be housed upon. There is a small little muscular layer at this edge the muscularis mucosa, which supports the mucosa and submucosal divide and keeps the villi rather rigid. In the submucosa, we're going to see all of the lymph vessels stemming from the lacteal diversions within the villus, as well as all of the arterioles and venules coming away from the villus that are going to be transporting materials into the villus and then out of the villus for circulation. The lacteals, in terms of the lymph, will flow through the lymph cycle. The veins here are going to go into the hepatic portal system eventually, along with the lacteals, which is going to transport materials to the liver for first pass absorption and sensing of nutrient information. Superficial to the submucosa, closer to the surface of the body, further away from the central lumen of the alimentary canal, is going to be the muscularis layer, and we have two distinct layers here. The two distinct layers we have is what's referred to as the inner circular layer and then the outer longitudinal layer. And so as we looked at with the peristalsis in the first presentation, those two layers are going to contract in a coordinated fashion so as to propel food in a forward direction and chyme in a forward direction for further digestion and absorption of the materials. And so if we were to look at this in terms of a histological arrangement, notice that we have the open lumen within the center. Surrounding the open lumen, we have the the mucosa layer. Deep to the mucosa layer, we're going to have the submucosa layer. Lying around the submucosa layer, we first get to the circular muscles, followed by the longitudinal muscles. And then eventually we get to the serral layer that's going to connect with the omentum and the mesenteries. Notice how it has kind of that same irregular shape that we saw with some of the veins, because there's nothing holding this open until there's actual stuff being moved through the alimentary canal based off of peristaltic motion. Wrapping around the alimentary canal, once we get through the esophageal fixture of the diaphragm, will be two sets of connective tissue. The first set of connective tissue is going to stem from the stomach itself. The second set of connective tissue is going to stem from the intestines themselves. Coming from the stomach is the omentum. Coming from the intestines will be the mesentery or mesentum. In this, we have two distinct types of omentum. We have what's referred to as the lesser omentum. The lesser omentum is going to come from the lesser curve of the stomach and is going to attach onto the liver itself and onto the structures around the liver, whereas the great omentum is actually going to be covering up most of the remainder of the alimentary canal and will attach onto the pelvic structures inferior to it. In the omentum and around the omentum, there will be a large amount of fat mass. This is the visceral fat mass. This is the same visceral fat mass that we discussed in terms of regulating thoracic changes with respiration. If we were to remove the omentum and reflect it back, we will see a set of connective tissue that combines with the tenia cauda and attaches onto the posterior surface of the abdominal cavity, and that is the mesocolon of the mesenteries. We then have a secondary set of tissue which will attach to the serral layer of the small intestine and will junction with the mesocolon onto the posterior surface of the abdominal cavity, and that is the rest of the mesentery. Within the mesocolon and within the mesentery, we will see the superior mesenteric arteries and veins, inferior mesenteric arteries and veins, and all of their branches heading to the various sections within the large intestine as well as within the small intestine. The mesentery and the omentum are there to hold everything in place during motion. Part of this holding in place is the connection of the liver and its anchorage via the falciform ligaments into the lesser omentum and then into the great omentum and the mesentum, the mesocolon and mesentery system, so that as we move around, the alimentary canal stays in place but is allowed to undergo its peristaltic motion without disrupting the other structures that might be within the abdominal cavity or the abdominal pelvic cavities within the body.